You know, I'm always
You ready, Vice Chair? You ready for this, Vice Chair? Okay.
I'm assuming that these people are not here to listen to us.
Me too. I sure hope that public hearing doesn't go for too many hours for them. Good afternoon, everybody. I'm going to call to order this meeting. This is the meeting of the Housing Policy and Development Committee of the City Council of Minneapolis. And I'm the chair of that committee. My name is Cam Gordon, and I'm joined today by all committee members, Councilmember Reich, Schrader, the committee vice president, Ellison, and Council President Bender, and Councilmember Goodman. I just want to let folks know this is the first of two meetings that will be taking place here this afternoon. This is the committee meeting that has to do with housing. It will be meeting now, and then we'll take a recess after this meeting, and there'll be a full council that will be meeting second. I suspect a lot of people are here to talk about the Hiawatha encampment and the possible location of a navigation center that will be is on our agenda. We'll be discussing it and getting a staff report generally about that, and then we'll also be getting another staff report before the full council. My intention here today is that the report that we're going to get here will be a little bit more general on how the navigation center might operate, what pieces are in place already, and some input on the staff direction. And we'll focus more on approval of a location and taking real action on that at the council meeting at 2:30. I'll also note that we're joined by a number of different guests from a number of different organizations, including several tribes from the state here: Leech Lake, White Earth, Red Lake, and I think I'm forgetting. Say that again. Okay, Leech Lake. Okay, I think I said that. Yeah. All right. Super. So I'm going to go through our committee agenda here. That we have one public hearing, and then we have consent items. We have one discussion item, and then an addendum. First, I'll go through the consent items and make sure that the council members are comfortable leaving them on consent. The first consent item is number 2 on your written agenda, and this is amending a resolution regarding the Riverside Homes bond issuance. Second item is modification to a redevelopment contract with American Indian Community Development Corporation for the Pocagama North project. Fourth item is approving additional Affordable Housing Trust Fund loan up to $650,000 for the West Broadway West Building Affordable Housing Project. Those are the 3 consent items. Does anybody want to pull anything off for discussion or questions? Seeing none, then I'll move all 3 items for approval. All those in favor, please say aye. Aye. Any opposed, say no. Those motions carry then. Then I think we'll go to our land sale. We have one land sale we're considering today, which is the land sale of 4111 Colfax Avenue North to Cherie Salim, and we'll get a brief staff report and then open the public hearing to see if anyone wants to speak on that. Welcome. Thanks for being here.
Good afternoon, Mr. Chair, committee members. 4111 Colfax Avenue North, the sale through Minneapolis Home policies for the program were established by the City Council on December 11, 2015, and further on February 10, 2017. Staff recommends the sale of 4111 Colfax Avenue North to Shahir Salim for its appraised value of $24,000 subject to conditions. Additionally, we were recommending awarding up to $20,000 to Shahir Salim from the Minneapolis Homes Programs Buyer Incentive Funds. The property at 4111 Colfax Avenue North was acquired on August 25, 2010 from the Twin Cities Land Bank for $22,454, with the dilapidated structure subsequently demolished. Staff has continuously marketed this property to a listserv of now over 2,400 people. This is the only application received. The lot size is 75 by 128, or approximately 9,600 square feet. The purchaser intends to invest $264,000 to build a duplex with 3 bedrooms and 2 bathrooms in each unit, and a lower level deed-restricted accessory dwelling unit with 2 bedrooms and 1 bathroom to live in as the owner-occupant. CPED's construction management staff reviewed the scope of work and estimates submitted by the applicant's builder and confirmed that they are sufficient to meet the minimum rehabilitation standards of the program. Notification was provided to the Weber Camden Neighborhood Association on May 22nd, 2018. The neighborhood supports this application. Mr. Shahir Salim is here in attendance today. Are there any questions?
I don't see any questions. Thank you very much for your report.
All right.
I'll open the public hearing on this land sale in case anybody wants to get up and just speak briefly. Thank you for being here. Why don't you introduce yourself?
My name is Shahir Salim. I am the supposed owner-occupier. Really excited about the opportunity to live in North Minneapolis, provide some additional affordable housing to people, and just kind of be in that community that I kind of grew up in, and just excited, hoping the city will grant the opportunity for me to do so.
Well, thank you very much. We appreciate you coming forward to seek that opportunity.
Thank you very much.
Did you want to move this? Is it in your ward? Councilmember Ellison.
While this is a little north of my ward, I'm always happy to see folks moving into the neighborhood and to welcome you into North Minneapolis. Sounds like you've been there already for a while, but welcome to owning this property, and I would like to move approval of this land sale.
Are there any comments or discussion on the motion? Seeing none, then I will call for a vote. All those in favor, please say aye. Aye. Any opposed, say no. That motion carries. Now we'll move on to our discussion item. This is a response to staff direction that we moved forward last meeting and went through the council process. And I think we're going to hear from our city coordinator to tell us about the status of the encampment on Hiawatha and plans for the future. Welcome.
Thank you, Chair Gordon and members of the committee. Always a pleasure to come speak to you, and it's been a lot lately. So today I wanted to talk a little bit about you, and I should say my name is Neria Rivera-Vandermeid. I'm the city coordinator. I want to talk to you a little bit about operations and how we're supporting the encampment. I know that we spent a lot of time lately speaking about the site for the navigation itself. And while important, and I know that we're going to talk about a little bit more about that in our next meeting, I didn't want to leave by the wayside what we're doing currently to support and to highlight some of the partnerships that we've established. I know I've mentioned in a previous presentation that we really did create a unique and rich and truly amazing partnership with community, with our state and county partners that has really helped shape what the needs are, how do we respond to it with urgency, as we think that from the beginnings of trying to stabilize and provide, whether that was lights or whether that was toilets or hand washing stations or figuring out how to connect medical services, and actually community really drove, and you'll hear a little bit from Mike Gozy later about the hygiene service area, which was an idea that was driven by community and has really been thoughtful with community in mind about how to make sure that there's a space to do showers and to provide and to get access to perhaps some medical and county services. All of these things have come together with the thought of ensuring that those at the encampment are met with dignity and have a place to go to if they need either medical or hygiene or any sanitation services. So we really wanted to figure out how to stabilize that and support the folks on the ground that are really working with those at the encampment. I'll say that as we've moved forward, we've also been thoughtful, and you're going to hear from some of our partners today about what does that look like in terms of housing referrals, Rule 25 referrals, what does that look like for what we've heard from community, which is we need not just chemical dependency programs, but there's a mental health component that we need to be addressed in programming as well. And so we've been thoughtful as we have learned the lessons from those from community and at the encampment. We've been thoughtful about that as we thought about the Navigation Center, about how do we program and how do we plan for operations. As many of you have noted, and we know quite well here in the city, we do not ourselves operate shelters. We do not ourselves operate these kind of services. So we wanted to make sure that not only was it informed by those that really owned and needed services and access to, whether that was housing or programs or treatment, but from those who are best equipped because they have been in this space, either as operators or in the case of our state counterpart, and you'll hear from Kathy Tenbrook a little bit later, those that have been entrenched in the work of the unsheltered for quite a while now. So I'm going to, unless I have questions, I want to yield the floor to some of those partners as we move forward, and wanted to start with Jennifer DeCubelis from Hennepin County. She is the Deputy Administrator for Health and Human Services.
Welcome. Thank you for being here.
Thank you. Council members, Jennifer DeCubelis, Hennepin County. I am the Deputy County Administrator for Health and Human Services at the county. And in partnership with the city, the state, and most importantly, the community, we continue to have daily phone calls and interactions and multiple times during the day to say, what does the community need? How do we best respond? How does government not necessarily lead, but do a lot of listening and finding out what is working with our government programs, what is not working, and how do we close some of those gaps? Listening to the individuals that we're really trying to get a different pathway forward with. To highlight a couple of the services that are being provided through the county, I spoke to the council last week on some of this, but I'll highlight some of the big lifts. We have the Office 10 Homelessness, which, as all of you know, is a shared effort between the city and the county, where we are long-term working on how do we reduce the numbers of homeless in our community, what are our strategic efforts, what are our joint efforts, what are the neighborhood by neighborhood efforts that need to happen. And this encampment has clearly highlighted for us folks that are getting left behind in some of those efforts. And it is challenging how we do programming and what do we need to change. And that's been the encouraging side of this, is we are learning a ton and being able to say, here's what is working, let's keep it going, maybe expand it. And here's where people are being challenged, and programs that are meant to help people are getting in the way sometimes. And so how do we make those adjustments? Our Healthcare for the Homeless team that operates out of Hennepin County has been at this work every single day. They have always been at this work for years and years, and they have stood up they were at the encampment before it was called an encampment, when individuals were first identified as living off of the Hiawatha area, to say, how do we engage them in healthcare resources, connections to services. So they are often our frontline responders. They continue to be on site as the community has stepped forward with work with Livio as a healthcare provider on site. We will transition to being a support operation, but certainly staying a presence and ensuring that we're connecting people as best we can to the healthcare services that they need. Chemical health has been a big response in the community, and chemical health is sometimes a technical term, so it is really dealing with addiction, whether that addiction is alcohol, whether that addiction is drugs, but how do we help people wherever they're at in the recovery and offer services and supports. We've had some great discussions in the last few days, and some of it was highlighted here in council chambers last week, where there were concerns about Rule 25 assessments not getting in front of folks. The Rule 25 assessment, for those who aren't aware, is kind of that first assessment that says what services and supports do you need, and folks have to get that assessment done in order to enter into recovery services. We are unique in Hennepin County in that we have direct access to some of our providers, but not all. We do have a state waiver for some of those providers to get direct access. And when we started to talk to the community, what we quickly dispelled was the Rule 25 assessment is not what's getting in the way. The recovery services and supports may be what's getting in the way. So do we have the right types of recovery? So addiction services are a continuum of services. It's everything from peer supports. I've got somebody else who has a lived experience that can help me get to a better place. We have residential treatment, which is often what people think of first. We have day treatment programs where there isn't a housing component, but I can go. There are culturally specific programs. But clearly what we're hearing from the community is something along the way isn't meeting the needs of the population. So that's what we're working on right now in partnership with the city and the community and the state to say what is the miss that's still happening. We have in Hennepin County a diversion and recovery team, and what that team is meant to do is crisis response. It is not about you must be 100% sober. It is a harm reduction model, an intensive case management model, and that team is on site to say, let's meet people where they are, what they will accept today as a service and support, and how do we gradually get them on a different path forward. That comes along with our mental health teams, whether it is our mobile mental health crisis team, whether it is a continuum of the mental health services and supports similar to addiction, There are all sorts of array of supports that exist in our community, and making sure we get the right supports in front of people and that they're meeting their needs has been a critical initiative as well. Our housing programs, shelter access is at the encampment on a regular basis, and what we have learned is family shelter wasn't working for a lot of folks. So the communities were calling out some of our own policies that were getting in people's way, and some of those policies are things like, I'm a parent with children and we have family shelter, we have individual shelter, but if I'm a parent with children and I have extended family with me, our shelter system wasn't working for them. So we've had to get creative and challenge some of our own policies and procedures to better meet people's needs. Our goal is to take care of the onesie, twosie families that are in front of us right now, but long-term to look at our shelter policy as a county and make those adjustments so that we're better meeting people's needs.
Can I just interrupt and ask a question here? How many people at the who were at the encampment have been placed in alternative housing? Do we know?
Council member, I don't have that number offhand. What I had as of yesterday were that 60 individuals or families, depending on what we're talking about, were assessed and approved for housing support. So in Hennepin County, it's not always just housing. We have housing with supports. So for people with disabilities in particular, we have waiver services and additional state supports that exist that can help people get and maintain housing and provide some supplemental funding. So the system is pretty complex. I'm not going to try to explain it all today, but certainly that's why it's so important to get in front of individuals and find out what they need. Of those 60 individuals who have been assessed for housing, a lower threshold of them have actually accepted it. But a lot have started entering into our shelter as we remove those barriers, which is a safer venue, an easier way for us to get all the services and supports around them. And then when we have housing identified, it's easier to locate and move folks in. We're working very much with the community in saying we need a better process, because what happens at the encampment right now is people come in and we don't have a mechanism to track who's there, what's their plan, how do we get them out and on a different path. And so there's lots of efforts running into each other. How do we say that what I know on a family or an individual at the encampment, the city also knows and we're working in concert, or the tribe knows and we're working in concert together? Those are some of the process improvements we're working to put in place, because what we're finding is as soon as we move somebody else is filling that tent. And that is some of the struggles of keeping track of the numbers. We also don't know if somebody leaves and we have a housing plan. We don't always know they grabbed that housing plan and they went into that housing. So there are some challenges operationally that make that a harder number to come to.
So 60 have been evaluated and determined that they qualify for housing supportive services. And we think some of them have availed themselves of shelters, but we don't know how many.
I could get some more specific numbers, but it's going to be limited by what the county staff, who they've touched, and do they know the follow-up. So I get a daily report that tells me what we're doing, where we're hitting barriers. Sometimes we know that we got somebody a spot and the report says, but they haven't shown up yet. And so we're trying to follow up and track them down to say, what's the barrier in following up? Have you changed your mind? Did something get in your way? Is there a transportation challenge? And it's working through those case by case.
And I understand that it's really difficult and challenging. It also sounded like you were saying that you don't have a very good number about people who haven't yet been evaluated but may qualify. And there's a sense that it's so fluid, it's very difficult to keep track of. And part of this is because I think what we're concerned about is how many people aren't going to be finding a suitable relocation before the cold weather comes, and we're trying to deal with that 50, 100, 150, 300, and there's all sorts of numbers. But you're also really unclear on how big the need might be even at the encampment at any given time.
Chair Gordon, I think that is fair. I think it is because the flow is constant in and out daily. If we don't have a great way to manage who's coming in, who's going out, that tracking becomes real problematic. And that is what we're trying to operationalize right now, again, in partnership with the community to say, how does that look? That doesn't need to be government-led. It could be tribal-led. But we certainly need a way to help make sure we're facilitating people to the right spots and identifying those who are falling through the cracks.
And tribal leadership is a form of government led, so I'll just note that for the record.
Thank you, Councilmember.
And why don't you continue? I think
Absolutely.
there'll be more questions later too, but.
Besides the chemical health, mental health is clearly a concern, getting people to those services. The housing and supports, as I mentioned, another big area is income assistance. So we are finding this is a population that can be underrepresented in our income assistance programs, so have not either been aware or known how to access what those services and supports are. So offering enrollment into healthcare, offering enrollment into benefit programs that they are entitled to, and trying to bring that to the location. It has been a challenge because of the separation of the tents and the hygiene area to make sure we're really getting everybody who has that capacity. The encouraging part about the navigation centers, we believe we'll be able to do that better because it will be a more systemic process that we can directly engage and make sure that people that have options and may not be aware of it are aware, and that we assist them in getting access to those benefit programs. And then the final area is really our public health. So we are in partnership with Minneapolis's Public Health Department in standing up a response. We have shared agreements, so the county and the city often work together on initiatives to say when one system's being tapped and needs to rely on the other system, we are present and available for where the city's public health department may need some backup.
Thank you so much. I think we might have some other questions. Council Member Bender.
Thank you, Mr. Chair. First, I want to say thank you so much for all that you and your staff have been doing on top of the normal work of the day-to-day and helping us, really be all hands on deck. And I know that you personally have provided a lot of leadership, and we appreciate it so much. I have two kind of main questions, and I'll just ask them both, and you can answer them however you choose. The first bucket of question is about the design. So we're about to have a council meeting where we talk about a site for a temporary navigation center. Mm-hmm. And our staff doesn't have the capacity or experience anyway to design shelter. And so I wondered if the county has staff resources available, or collectively, whoever would like to answer this question, who can help us facilitate the design of whatever might go in. And I would imagine that would be in coordination with the tribe and each of the different city, county, state, community. And then the second question was about, can you walk us through the county's approval process for funding? So are we looking at an administrative decision about how to spend existing funds, or likely anything that would come from the city would go through our city council approval process for additional funding, and we would need to find a funding source? Can you just kind of walk us through the general process that the county would follow to allocate funds, if the county chooses to, for temporary navigation center, either for shelter or services?
Absolutely, Council President Bender. The navigation center concept is, so it is a new model. It's a model that's happened elsewhere in the nation, but isn't something we have experience doing here in Hennepin County, but certainly in partnership with the tribes, the state, and the city are looking at those models and saying, what can we learn from that, and is that something that will benefit this current situation and the people we're all trying to serve? So I would say it's less of a shelter model, and it is much more of a center. How do we better connect people to all the services and resources I mentioned? And that's just a snapshot of Hennepin County's. How do we better connect people so that we make it easier for them and remove the barriers to their accessing services and care? We do not currently operate our shelters. We do that in partnership with community providers. So there are community providers that operate a shelter network for us. We do have over 1,000 beds of shelter in Hennepin County, which is huge. A lot of our surrounding counties do not even have any beds, or they have 5 beds or 10 beds. So we have a significant system. I will say I'm not looking to add shelter beds, because what we've repeatedly heard from the community is shelter isn't the answer. Shelter is a temporary solution. It's not the longer term solution. So we'd rather have our dollars and our investments going to longer term stability and self-sufficiency for individuals and families. But what we are watching is, if this model is successful and we get better outcomes and we hear from the community that this is working, do we take some of our existing shelters and move them towards this model over time? So I would say the Navigation Center is, we've got some national expertise that's going to, looks like will be willing to walk alongside us to help guide this as well. We will all have learnings in partnership with the community, and then we'll figure out what the long-term strategies are. I would say we absolutely are in partnership to say who is best to run this, whether it is the tribes that say, we've got this, whether it is a community partner that says, we've got this, whether we have to stand up some expertise that doesn't exist. I don't know that we have all of those figured out, but certainly everybody's at the table to have that discussion and say what is the right answer for this first phase of the navigation center. Approval process was your other question, and the approval process at the county is it does go through our county board, much like it comes through council chambers here. What I am looking for, again, in the discussions that we're having, we had one just the other day to say what are the services and supports that we think are needed at the navigation center, and at the point that we have the head nod from the community that says, yep, this is what we need, for me, that is looking at what is existing funding. So there is existing funding for a lot of the services and supports that we're talking about. So ideally, we can braid existing funding into this model, but until we get to that level of detail, it's really hard to say, are there any gaps? And that's what my worry is if we say, here's the model, here's the services the community wants, we can quickly go through that list and say there's an existing funding stream for these first 5, but this 6th one doesn't, and we have to get creative. And that's where we'll have to have some discussions about how do we close those gaps. There's a commitment to figure it out, whether it is through foundations, whether it is through philanthropy, whether it is through tax base. But again, until we have more detail, those are hard discussions to happen. If it's current funding and braiding, we can do that oftentimes just through agreements. An example of that would be, I know Nuria mentioned the work that Mike Gozi and AICDC has been doing. So as they've identified opportunities to bring up new housing programs with supports, oftentimes it is a simple agreement between the state and the county that says, let's reallocate existing funding to help support this. We have another mental health program that is looking to stand up a 16-bed response as well for some stability of housing. Again, it's leveraging state dollars that exist today and pointing them to these projects. So far, I haven't identified where we have gaps and we don't have some solutions, but I know they're out there, and it is getting to that next level of detail to be able to do that. If I can do it under current agreements between state, federal funding, and county funding, we will do that. If it needs to go in front of the board as an ask, it does come through our committees, similar to the council here, where we can bring it in sometimes as an immediate approval, but it does have to come before our board, depending on the ask. So,
Do you have a follow-up question, Council
Just one
President?
short one, yes. Thank you, Mr. Chair. Is the threshold for approval of a dollar figure, whether it's administratively determined or board approval?
it can be more complicated than that, depending on, again, if I have existing agreements that I can do amendments to. Sometimes we can do amendments without going before the county board. Other times there are contractual agreements where we have a signature authority up until a certain amount before it goes to the board. Those numbers tend to be pretty low, the 50,000 and below.
And is there, are there regular meetings like we have that the county board would be able to take this up, or would they be looking at scheduling special meetings before do they adjourn for the year? And are there time constraints related to the board process?
Councilmember Bender, there are not restraints in that the board meets every single Tuesday. We do have routine Tuesday meetings. We can always call on a meeting. We have to publicly notice it, but we can always call additional meetings if needed. And we have the ability to we have an immediate approval process that can expedite things if time sensitive. So I'm not concerned that that's going to be a burden to us moving things forward.
Mr. Chair, if I may just a brief comment then. I think stating two obvious things, but we'll need to coordinate, of course, between elected officials and then on the staff level about the timing of any budget approvals to make sure that we can be as coordinated as possible once we have a budget. And then this may be the most obvious statement, but I think we all expect that someone who has experience with housing people in some way is helping lead the design of this, that we make sure that we are drawing on expertise, that even though it's a very temporary habitation, that it's humane and safe and something that we would want ourselves or our loved one to be staying in even for a temporary period of time. And so if we need to identify that capacity, I think that seems like a high priority for the partnership table, including the city, to help step forward and figure out how we can get that capacity on board if we don't have it now. Thank you.
Absolutely. Thank you.
And I see there's other questions. I think we really welcome the opportunity to have you here and to learn more about this. Councilmember Cunningham. And I'll just note that I'm delighted that we're joined by some council members who aren't on the committee, including Councilmember Cunningham, Kano, and Warsami. Welcome. Glad you're here.
Thank you, Mr. Chair, for allowing us to sit in and be able to ask a question. Thank you, and thank you for the information that you've been presenting here today. As the chair of the Public Health Committee here at the city, I'm pretty familiar with what's going on with city staff. I've been really in conversation and of support. And so I wanted to take a moment to dive a little bit deeper into the partnership between the county and the city when it comes to public health. So the county is the social service provider, provides actually direct services, whereas the city more is infrastructure. So when we are thinking about setting up, the way that you describe the partnership is when the city is activated, the county comes in as support to help. Can you describe that again, that partnership and how that's structured?
Absolutely, Councilmember. And my comments for that were specific to the public health function. Okay. So less about the human services, which a lot of the chemical health, mental health, shelter access is all in our human service arm. The public health functions are, so for example, when we were concerned about disease spread or disease response, we can back up influenza shots, we can back up Hep A implementation. So it is the disease management. So anytime we have anything that exceeds each other's capacity to respond, we can leverage each other's staff. So we have an epidemiology department where we can deploy them over because the city of Minneapolis says, gosh, we've got this many nurses that can go out and provide this service, but we need 5 more. Well, we're going to, under our memorandum of understanding, we're going to deploy our nurses in partnership because they're joint residents that we all want to be responsive to. And so we don't draw that hard line between you're the public health department for the city of Minneapolis and we have outlying areas. It is an ability to just lift up a phone call and deploy staff where necessary.
Okay, so I see it's a little bit hard, I think, from my perspective to be able to separate public health and human services because right now it feels like they're deeply correlated in this space. And so one of the challenges that have been found and I'm concerned about is that there is a lack of clear coordination of social services. So like what are the services? How are they being implemented? Because again, the city is not a service provider in that way. And so we're really looking to the county to be able to have that coordination in place. And, in terms of investment, like the health department, the city's health department has had to step up significantly financially in order to meet a lot of the needs, including like the porta potties that came out of the city's health department budget. And then the size doubled. And so then we had to take more money out of that. And so, I think currently what we have set up is unsustainable for given the purview of the Minneapolis Health Department is a little bit more infrastructure based. And so I just wanted to ask, what is the coordination plan? If I'm hearing from several folks that if it's hodgepodge, oh, we're going to give this group some money to do this, we're going to do that, we're going to bring in these folks and do this, but there isn't a clear coordination about what's happening. Is there a plan for that, and what would that look like?
Council member, I would encourage some detail behind that, and I'm happy to talk offline about if there's details about that. We have regular calls with Commissioner Musicant. So we are in close alignment. So I haven't heard the disconnect. From a coordination perspective for human services, we have a schedule, and that schedule is shared with your incident command. We have an incident command. They brief each other on a regular basis. We share situational reports. So all the detail that I have is also available to your team members, as is the schedule of where our staff are, who's on site, what is needed, and we have constant dialogue about what's working and what's not working. So if somebody says, you know what, we need more mental health assessment time on Monday afternoons, it's getting crazy over there, and we absolutely need to stand up a stronger response, then our job is to respond to that and in partnership. I am not aware of a single request that has not been met at the county. And so if you are hearing things that are not working, I would encourage, if it's not at my level, it's not getting into those situational reports and it's not getting solved. And we absolutely I'm not saying that it doesn't happen. I'm saying if there isn't the awareness, then we need to improve our communications, because at the staff level, staff feel like they're running alongside each other very well. I know at the leadership level, Nuria and I are on red lines on a regular basis and staying in touch. So if there are some misses that are happening, I would encourage somebody to reach out to me directly, and we're happy to respond.
Have a question, Councilmember Cano?
Thank you, Mr. Chair. I appreciate it. Ms. DeCubelis, thank you for being here today. As you know, this is a very pressing issue for our residents, and because we're local government, we get an extensive amount of calls from people that are really concerned about what's happening and in general about why we let this get this way. So one suggestion that was posed to me by a resident was, why doesn't the council come together with the county and other jurisdictions to have a multi-jurisdictional task force to look at this issue and anticipate when something like this might be bubbling up again, so we can be taking proactive action and not scrambling at the last minute to try to figure out how we get something built before October 30th to avoid the cold. And so I imagine that we might already have something like that. I'm not on the housing committee itself, so I don't follow these issues as closely as perhaps I could if I sat on the actual committee. But we've been delving into this issue just as Ninth Ward residents, and of course as the person who serves a lot of the constituents who are at the camp every day doing outreach work. So I'm curious to hear from you about your suggestions about what is this kind of multi-jurisdictional table of decision makers, not only staff, but I think that what we've seen is that elected officials need to be held more accountable to the work that's happening, be more involved, be more closely aligned with the decisions that are being made and how resources are being allocated. So I'm just curious, I mean, is Heading Home Hennepin like where we should all be kind of focusing at and pointing to? Does there need to be a new task force that gets put together? Is there one already that exists? What does this work look like moving forward so that we don't get blindsided by something like this in the future?
Councilmember Cano, absolutely the Heading Home collaborative that we have has city representation and county representation. I think what's been missing, it has community representation. I don't know that it has comprehensive community representation. So I think we have heard, and you heard this last week, that the African American community as well as the Native American community feels like we haven't stood up the same type of response. So I think we do need to look at that membership and say, do we have the right people there? This is not a new issue. I would say that Heading Home Committee has been looking at the fact that we have hundreds on our transit on any given day sleeping. We have 1,000 shelter beds that are full or near full every single night. We need to stand up a different response because our current response is not getting people to that longer term sustainability. I would also mention that nationally, this is a national problem. This is a national trend. Affordable housing is an issue. Workforce housing is an issue. Housing with supports is an issue. So there is a state role, there's a county role, there's a city role, there's a community role, there's certainly a tribal role. It will take all of us thinking differently, and I think what we're capturing as a part of these incident commands are where are we missing people? So you heard me mention some of our shelter policies that have gotten in people's way. We're cataloging those, and we're not cataloging those just to respond to this one encampment issue. Because we know we've got multiple encampments all over our community today that just aren't as large and are not getting this level of attention, but they're just as important. So part of that is how do we catalog what is and isn't working, and then how do we partner together to change the policies in order to ensure that they better work for people. But we have a housing crisis, and it will take all of us to stay at the table longer term to not have this just move to another location. I think that's all of our worst fears, is that if it just moves to another location, we haven't solved this for the individuals.
Thank you very much. I just want to note that it's almost 2:15, and the hope is that we can take a small recess between this and the council meeting, and I'm not quite sure how many other people that we're going to hear from. So do you think we can move forward? City Coordinator?
Chair Gordon, thank you so much. And I just want to reiterate our commitment. What we have learned from this is that this is not just about the issue right now, but we have learned some lessons to scale up, to really think about the unsheltered broadly, and not just here. And so you've heard a little bit about what the county has been doing. I want to invite our state partner, Kathy Tenbrook, who heads the Office to Prevent and End Homelessness. And we have one more person who represents community, Mike Gozi from the AICDC, to just speak briefly about those efforts operationally with both what's happening now and some thoughts about the new navigation center.
Okay, thank you. Two more speakers. Welcome, Ms. Tenbrook.
Hello, council members. Thank you very much for having me, and thank you for your leadership on this issue. I'm honored to be here, and while I am deeply aware that the city and the county are lead jurisdictions with tribal government and community partners on this Minneapolis encampment specifically, I want to express my support and the support of the state in our partnership with all of you as we work on this really critical issue. So my name is Kathy Tenbrook. I'm the state's director of our Office to Prevent and End Homelessness, and I also direct the Minnesota Interagency Council, which is a cabinet-level body made up of the commissioners of 11 state agencies, the chair of the Met Council, and the governor's office. And as you all know really well, in partnership with many of you and in partners all across the state, we have been working on preventing and ending homelessness for many years. And where we have collectively turned our attention over the years, veterans homelessness comes to mind as a really good example. We have really seen some tremendous progress. But the truth remains, and you've heard this already, but we do not have the scale and the type of housing options in this community or in this state or frankly in this nation to serve all people who need that housing stability. So while we have collectively made some important progress, we've seen the same kind of really concerning trend lines, as you heard from Jennifer, that people have seen all across the country. While some populations of people experiencing homelessness, the trend lines have been going in the right direction and going down, even amidst this very challenging housing crisis, the number of people experiencing unsheltered homelessness has been going up in Minnesota for the last 4 years. We've seen about a 40% increase in the number of people experiencing unsheltered homelessness. So, of course, this speaks to the greater need and focus on the kinds of housing and supports that are necessary to serve people who are experiencing unsheltered homelessness. In the immediate term, however, it means we have to collectively turn our attention to proactive strategies and alignment of resources to better serve people right now who are unsheltered and in unsafe circumstances. The governor has instructed all of the council agencies to do all that we can to identify existing resources and services and programs to be used as effectively as possible to support all of the local partnership here to better serve people in the Minneapolis encampment. And this includes the Department of Human Services coordinating closely with Jennifer and the county on critical services, both housing support services and economic supports. It also involves the coordination of public health entities at the state level with another incident command structure in place there as well. But to your question, Councilmember Keno, the governor has also asked that we do this urgent work with an eye toward the kind of alignment and coordination that can assist us to be more proactive, to proactively address unsheltered homelessness all across the region. And we want to ensure that we are identifying each of our most critical roles and doing everything we can to coordinate and be more effective, aligning the response. Right now, in addition to the encampment, my office and the Interagency Council is also focused in partnership with the Met Council on people experiencing unsheltered homelessness on the light rail. We're in conversation with St. Paul and Ramsey County about increasing encampments in St. Paul and Ramsey County through their Outside In initiative. And so in time, when the time feels right to you, I know you're urgently in this focus, as are we, but we would like to turn some of our conversations to this regional response to unsheltered homelessness and talking about the broader ways we need to address the issue. So, and I mention that to just be really clear that in no way do I mean for us to take 1 ounce of urgency away from what we're talking about right here, right now. But in fact, I think what we're learning from this experience and the collective work we're doing together can really provide a great deal of guidance for us for this broader conversation. So in addition, I've talked to Nuria, and I'm really grateful, by the way, for the partnership with your city coordinator. She has been fantastic and communicative and very responsive. I think we've worked really well together, along with Jennifer and community partners, folks at MUD and others. I've also expressed that I would be very willing and very happy to connect with national colleagues who unfortunately have experienced this sooner than we have along our path of working on preventing and ending homelessness. One of those partners came with me yesterday to a meeting with Nuria and Jennifer and Patina and Commissioner Piper and others in our partnership meeting to talk about this opportunity of a service navigation center. She had the job of actually setting up a service navigation center like this in Seattle, and the housing director of the largest housing agency and service agency in the Pacific Northwest. So has a lot of experience in this. And I think the opportunity with national partners is not to have somebody come in and tell us what to do, because our situations are very unique and very community driven, and that is key to any kind of success, but to help us think and make sure we're asking all of the right questions. What do we need to make sure we are thinking about in partnership with all of the jurisdictions and our community partners before we launch into the operation of a service navigation center. So I'm happy to continue to bring those voices to the table if desired and if helpful, as well as potentially some philanthropic partners as well, who have also really stepped up and want to be part of the solution as well. So with that, I know you have many things on your agenda today. I will stop and just see if there are any questions at all.
I don't see any questions. Thank you so much for being here.
Council members, and lastly, I'd like to invite Mike Gozi, who has really been such a great leader and partnership with MUD as we form a coalition moving forward on operation.
Chairman, council members, thank you for letting me speak. AICDC, when the camp became the size it is, AICDC felt that we had to do something to coordinate some services and to provide a level of hygiene and humanitarian support to the camp. We have been delivering 120 lunches a day, bag lunches, to meet the needs of a lot of the people there. Sometimes not all, sometimes we have leftovers. And so, and then we built the HSA, understanding that we had to make a stand and a step forward in helping the people. We have 3 showers there. We've been open 3 weeks. All right, this is the start of the 4th week today. And in that time, we have had over 700 people through the showers. Last Sunday, we had 3 stylists that volunteered their time and gave haircuts to camp members and their children. And it was incredible to see how it affected the people. And they felt pampered for a short period of time. And I think for that half hour or 45 minutes that they were being groomed, they felt as if they were cared for and benefited from that. We have provided space for services, and we've had numerous organizations at the county and the state and city and nonprofit organizations that have come to the aid of the campers. We have provided Rule 25 assessments. We do the housing assessments there. I think in total there's been over 125 housing assessments. And so the 40 or the 50 that we talk about are the people that have been approved for a level of housing. What we know, I was in a MUD meeting yesterday, and we talked about the disconnect between the services and the residents of the camp. And we will be putting together a plan to bring to the city and the county as how we feel as the community we would better serve the people. We need navigators to get people from point A to point B. I think that when we look at our current shelter situation, that's not what's going to serve this population. When I look at the camps and I look at the tents, I see people's whole lives within the tent. And so it's not as if they have a backpack and a toothbrush in their pocket. Some of the campers have their whole lives within their tents, and we have to respect that. The the differences that we see in regards to our families, our culture, and the caringness for each family is something that has been talked about a little bit here, but it needs to be further addressed. I commend the state. We started a program called COLA Safe Haven. It opened December, and we serve up to 18 people there from the street to housing. And we were able to do it because the state changed the rules and did a block grant from the state to the county, and the county did it to AIC, gave it to AICDC, so we can serve the people where they're at, and we can make the adjustments at our level, not at their level, as far as the city and the county and the state. And so as we look forward, we have to understand that we're in new territory. You know, we can look and see what people have done in the past, and we can take their experiences, both good and bad, and grow from that. But I think what we're looking for our community here today is a new model that will be successful for the people that we work with. And that's going to take collaboration and coordination from within the community and within the larger communities and with the city and the county and the state. And we look for the support of the tribal governments to help us in identifying tribal people and how the tribes can help their constituents in creating new housing options. I guess that's really where we're at today. We'll be in a planning stage for the next couple of days in regards to what we feel as MUD, not the community, as how we move forward in preparing people even for the navigation center. Chairman, you brought the fact about connecting people to housing. We need to have people to help them do that. When they have their whole home within their tent, and you say, all right, here's a voucher and a bus ticket, or here's a voucher and a token, get down to the Drake, it's unreasonable, and it's not happening. And AICDC, we have our own case managers, and we ourselves have housed 7 people from the camp into our own housing, and I think that's the best that's happened so far. I know that last week there were 6 families that were housed in shelter through Hennepin County, and because our effort was for single women and families and moving forward. And so that's really what I got to say.
Thank you very much. We really, I just, on behalf of the committee and the council, we really appreciate what you and all the community organizations and groups have done out there to help with this. Do you have anything to add?
Just finally, Council Chair Gordon and council members, just want to say that as you've seen, we'll continue to work in partnership as we move forward. One of the things that we really wanted to thank, not just MUD, but all the tribal leaders, is to make sure that we are doing this with people's needs and interest in mind, and that is what we will be bringing forward as we continue to do our collaborative work. So stand for questions if you have any.
I see one question, Council President Bender.
Mr. Chair, I just wanted to note that if we are to start our council meeting at 2:30 to discuss the important issue of a site decision, we need to adjourn this meeting now in order to give our staff time to reset everything for that meeting.
Well, then okay, I understood that, and I was heading in that direction, but thanks for reminding me. All right. We have to end this meeting, and then we're going to begin the next meeting. Okay. I want to make, so there's, the presentation is over now. So I'm going to move to receive and file that report, and then we have one other item to take up. And I'll be here.
Can I just say what I have to say?
You heard from all these.
I'll be here to talk to you between meetings.
I'm going to say address the whole city council.
Okay, well, we'll be in a few minutes, and we can see about that. The whole
It's
city.
only going to take me like less than 4 or 5 minutes.
All those in favor say aye.
Aye.
Any opposed say no. Well, that motion carries. We also have one other item where we have to refer an inclusionary zoning ordinance that was at the council last meeting to staff. All those in favor of that referral, please say aye. Aye. All those opposed? That motion carries as well. And our business is over, so we can adjourn this meeting. And I'm going to stay here and let you tell me what's on your mind while we get ready for the next meeting.